The FDA's recent move to grant emergency use authorization for convalescent plasma as a potential treatment for severe COVID-19 was met with some controversy.
With many critics pointing out a lack of available data to support the treatment. But now a small study has found evidence that convalescent plasma can be beneficial for some patients with severe COVID-19. Our chief health editor, Dr. Nandi, joining us now this afternoon. Good afternoon, Doc. How are you?
Hey, good afternoon, Glenn Allen. Yeah, I love research, and based on this research, it does appear that the convalescent plasma can bump up survival rates. Right, this new study had two separate groups of patients at Mount Sinai Hospital, New York City, all of them had severe COVID-19. So this is a select group. Now, 39 patients received plasma treatments, and their outcomes were compared to 156 patients who were not given this experimental treatment. And here's what the researchers found, that on day 14, only 18% of folks who were treated with plasma therapy still needed oxygen supplementation, compared to 28% in the group who were not given the infusion that still needed oxygen. And by the end of the study, get this, 13% of patients treated with the convalescent plasma had died, compared to 24% of the patients who were not given the infusion that died. So good news.
Yeah, it's a very good news. But Doc, we've talked about this before, but can you remind me and all of us what exactly convalescent plasma is again?
Absolutely, Alan. So this is not a new approach. It's really an old approach. When you get an infection, right, your body goes into fighting mode, right? It's like it wants to kill whatever bug's there. And then it makes antibodies. And the idea behind convalescent plasma is that folks who have fought off a disease, in this case, happens to be COVID-19, they can then donate the blood. Now, the blood gets processed, only the plasma and the antibodies, the ones that's fighting this disease, are left behind. And by giving survivors blood that's rich in antibodies to those who are battling severe COVID-19, the idea is this will hopefully jumpstart, right? Rock their immune system and help them recover.
So how about the side effects, Doc? And are there any downsides to this study based on how small it was?
That's a big question, right? People are like, what's going to happen? What are the bad things? The good news, Glenda, is that researchers did not, and I repeat, did not find any adverse side effects that were severe caused by this plasma therapy. So that's good news. But at this point, it does appear to be safe. And yes, we have to admit, this is a small study, right? So we need bigger numbers. And the downside is that we need higher quality studies to really confirm the results. But so far, looking at the study, convalescent plasma does appear to be helping some folks who are very ill with COVID-19. Here's the thing, a lot of people with big brains coming up with different ideas to attack this virus. So I'm very hopeful that between the vaccines and the treatments and us doing everything possible to prevent getting it, we're going to beat this thing.
All right, that's encouraging. Thank you, Dr. Nandi.
My pleasure.
And remember, if you do have a coronavirus question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or be sure to send it to us on Facebook or Twitter.